Hello everyone, I'm Daniel Manalo. The Philippines has been severely affected by COVID-19. According to latest WHO figures as of January 2022, the Philippines has recorded over 3 million confirmed cases as COVID-19 with over 52,700 deaths. Since March 2020, the country has taken strict measures to halt the spread of virus, including lockdowns such as enhanced community quarantines. The impact of COVID-19 has especially been significant on TB and HIV. And in 2020, the National TB Control Program recorded a marked decrease in TB testing as well notification for TB and drug resistant DRTB. In 2020-2021, COVID-19 cases surged again as the Delta variant spread. In 2021, through our COVID-19 response mechanism, the Global Fund supported the Philippines with over $37.7 million to fight COVID-19, including to expand COVID-19 testing capacities and support the COVID-19 case management strategy. In addition, intervention focused on COVID-19 mitigation measures for HIV, TB, and malaria programs. This includes telemedicine, mobile clinics, bi-directional testing, digital tools to help patients adhere to their treatment, improving TB case finding and transportation networks to transport samples, supporting differentiate service delivery approach to providing HIV, and integrating information campaigns for COVID-19 and malaria. The program also supports social protection intervention, community-based organization, strengthening addressing community needs like mental health support and gender-based violence prevention. The Philippines was one of the first countries to develop a strong, comprehensive TB adapted plan to the impact of COVID-19. 2 years after the coronavirus pandemic shattered the Philippines, most parts of the country have fully reopened, with the Duterte government pressed the usher in a new normal and just jump start to the road recovery. Vaccinations of full swing. Students have started returning to schools, while restaurants, cinemas, and stores have opened for business. Millions of Filipinos likewise appear ready to move beyond the pandemic. But between then and now, over 57,000 Filipinos have died and more than 3.67 million more have gotten sick with COVID-19. Only 57% of Filipinos have gotten fully vaccinated. Rappler reviews some of the major changes that have taken place locally 2 years on. Since the start of COVID-19 outbreak, WHO has worked with countries and areas in West Pacific region of public health measures to slow or stop the spread of virus. Safe and effective vaccines are an important tool, in combination with other measures to protect people against COVID-19, save lives, and reduce wide-scale social disruptions. Countries and areas in Western Pacific region have already completed regulatory approval and started introducing one more COVID-19 vaccines. Through the COVAX Global Vaccine Facility and other mechanisms. WHO and partners are working with government to facilitate equitable access to an distribution of an initial allocation of vaccine as quickly as possible. WHO recommends that initial vaccination should prioritize groups and highest risk of exposure to infection in each country, including health workers, older persons, and those with other health issues. Once COVID-19 vaccines reach priority groups, countries should vaccinate other priority groups and general population. It is important to get vaccinated as soon as it's your turn and continue practicing other protective measures. That's all for the highlights latest events of COVID-19.